It is October 9th, Thursday, and I'm Dr. Ara Deuk-Majan, CEO and founder of the Deuk Spine Institute. And I just want to know what everyone thinks about our new, what do we call this, home screen here for the...
Intro, home screen, just an intro for the live streams.
All right, what do you guys think about the new screen, intro for the live streams? Henry worked really hard on it, and I think it looks amazing. We are going to be making some changes in terms of how things look. Still keeping our standard colors of royal blue, gold, and white, but we're going to change a little bit more of the graphic art. And look for those changes over the next couple of months. It is the month of October, one of my favorite, the month I got married, as a matter of fact. A lot of people get married in the month of October because the weather is so nice. And our patient comes to us from Canada. She has been suffering with back pain. She has two sources to her back pain, two. One is a disc, the other is a piriformis muscle in her buttock. We're going to fix both today. So Henry, if you don't mind, let's start by showing our audience the 30 different causes of back pain that we've discovered here at Deuk Spine Institute. And we'll talk about her problems shortly thereafter. I'm Dr. Ara Deuk-Majan with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majan. Thanks for joining us.
All right, welcome back. Our patient, once again, is from Canada. She's had lower back pain, leg pain, and now buttock pain. She's a professional golfer. That's all I'm going to say. I don't want to give her identity away. We just tested the L5-S1 disc to see, is it causing her pain? Because I believe it is causing her pain based on her MRI and where her pain was. She also has severe buttock pain right there in her piriformis. So she's got two problems: painful disc, painful piriformis. We're fixing both today. I tested the disc to see if it was painful. She said yes, 10 out of 10. I asked her, is that where you get your pain every day? She said yes. So that's called concordant. She has concordant pain at L5-S1 with the discogram. You can see this is where we're going to make our incision. But let's look at the x-ray real quick, Henry. You can see where we injected the dye in the disc, and it literally, the dye ruptured out through a tear in the back of the disc. Show the tear. Yep. And then it traveled along the thecal sac or outside in the epidural space, and it went down the S1 nerve roots. You can see the S1 nerve roots on both sides. That's what those black lines are. You see those?
Yes, we do.
So, yeah, the dye burst out of the tear and ran down her nerves, and you can see all that on the x-ray. Pretty damn cool. All right, we're going to get started. If you have questions, type them up. In the meantime, we'll talk about these 30 causes of back pain. 85% of patients with chronic back pain, their disc injury, an injured disc like a herniated disc, bulging disc, ruptured disc, is the number one cause of back pain in 85% of people. So if you've got back pain, it's very likely it's coming from an injured disc. Now, when we analyzed the patients with disc pain, over 5,000 patients, they had 2.4, basically 2.5 discs that were painful on the average patient. So that means there were a lot of patients with 2 discs and a lot of patients with 3 discs that were painful, but very few were 1 disc. This patient is 1 disc. So she's lucky she only needs 1 disc fixed. Once again, the average patient with back pain that's chronic, 85% of the time it's coming from injured discs with inflammation in the back of the disc. The second most common cause of back pain is the facet joints. And now I'm starting to think it may actually be the piriformis. We're seeing a lot of piriformis muscle pain over the last few years. All right, let's show the audience, Henry, how a disc problem can be so painful. Take that out.
Disc injuries start with an annular tear, damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Before we go any further, our patient here asked for me to do a shout out to two of her best friends, Allison and Lisa. Allison and Lisa, per the patient's request, shout out. All right, we are getting ready to show you how we fix a painful disc. Now, this treatment was pioneered right here at Deuk Spine Institute in Florida by myself. I am the guy who discovered this treatment is a cure to back pain and neck pain when it comes from a disc injury. If you don't have a disc injury as your source of your pain, this would not be the right treatment. So this is only for people with painful discs. But the success rate of this surgery is 100%. 99.6 was the number, and rounded up, it's 100%. So 100% of patients with disc pain will be cured with Deuk laser disc repair. There is no other treatment in the world that works. None. That's why there's so many millions and millions of people with back pain, because doctors don't know how to fix it. And we figured it out right here. I want you to look carefully at this screen. You see that reddish pink stuff? That is inflammatory tissue. That is a sign of inflammation. Inflammation is what causes the back pain. You guys just saw that on the video. Now we're going to show you another video on how we cure back pain with the laser.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A quarter-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
To become an expert in the world. Welcome back. You can see from our video we use a laser to clean up the annular tear, removing the inflammation, removing the herniation, removing the calcification, the granulation tissue, the pain fibers. That laser fiber is right there in front of you. You guys can see it right there. It is 1 millimeter wide, 1 millimeter. That's the glass part, not the blue part. The blue part is just a plastic covering over the fiber optic laser fiber. This is where all the pain is coming from, right here. Can we get her blood pressure down? So her blood pressure has crept up just a little bit. It's still within the normal range, but it's going up because there's something a lot of people don't know. When you have pain, the pain is transmitted, signals are transmitted along nerves. The nerves can go to two places. One is the part of your brain where you're aware of everything, called the consciousness, and the other is subconscious. Now, subconscious pain centers are in the brainstem, specifically the medulla oblongata and the pons and the midbrain, okay? These parts of your brain are subconscious. The cerebellum is as well. But basically, subconscious consciousness is created through awareness of your environment, of what's happening, either internally or externally. And consciousness lives in your cerebral cortex. The cerebral cortex is the newest part of your brain. The subconscious parts of your brain, which is the brainstem, cerebellum, those are very old. And they are millions of years old. So the oldest parts of our brains, the subconscious parts where we're not aware of consciously, that regulate blood pressure, heart rate, those parts of the brain are extremely old. They're the oldest parts of the brain, okay? The reflex loops are really the oldest. Long story short, for you to be aware of your back pain, it must reach your cerebral cortex, or the newest part of your brain, okay? The neocortex. Hold on. Remember, the neocortex, or newest part of your brain, neo means new. Neocortex, new cortex, is the part of your brain responsible for consciousness. If the pain signals don't reach your neocortex, which is, by the way, Brodmann area 312, part of the sensory homunculus. If your pain signals don't reach your neocortex, then you will never be aware of the pain consciously. But your body can still feel pain subconsciously if it arrives at the brainstem, at the medulla oblongata and pons and midbrain, because those areas also receive pain inputs, and they control your autonomic nervous system, your heart rate, your blood pressure. That's why when you're having pain, it causes your heart rate to go up and your blood pressure to go up, because those pain signals are synapsing in parts of your brain that you're not consciously aware of. And that's why you can't also just increase your heart rate consciously. Can't do that. You can't make your blood pressure or heart rate go up by just wanting them to go up. There has to be a stimulus. All right, any questions?
At this moment, no current questions.
Great. Well, we did put this on the calendar, right?
Of course.
Yeah.
100%.
Well, we had a piriformis as well on the calendar,
That too.
but that patient decided not to do the surgery, which I think was the wrong choice, because he's still going to end up having piriformis pain. It's never going to go away. But some people make, everybody has to make a choice for themselves. We don't force people to do what's right, and a lot of people choose to do what's wrong, and that's their personal choice. This patient chose the right thing, so she's going to be rewarded for making the right choice. She's going to be pain-free once she heals up from the surgery. Any questions?
At this moment, no current questions.
Well, Henry, in that case, why don't we show the audience, since we show them how a disc injury is so painful, like a herniated disc is painful.
Yes.
We showed them how we fix it here at Deuk Spine with laser,
Correct.
endoscopic. Let's show them why the laser surgery is the best treatment in the world for discogenic back pain.
Hi, I'm Dr. Deuk Machen. We've just completed our free MRI review at Deuk Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation, and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint, or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically, people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Deuk Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk laser disc repair. We've been performing the Deuk laser disc repair since 2006 here at the Deuk Spine Institute. To date, we've had 0 complications. The Deuk laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening.
Welcome back. You guys just saw our comparison video. Why would you ever want anything but the Deuk laser disc repair? Look at this incision. We're already done. We had maybe 5 cc's of blood loss, minimal. And the patient's pain is going to be gone permanently the rest of her life from the L5-S1 disc. Thanks for joining us. We'll be back shortly with our second stream of piriformis muscle release.